Hi, my name is Dr. Galina Malas, and I am so excited to be here with you guys today. I'm a naturopathic doctor, and my patients actually just all call me Dr. Galina, so that's what you can refer to me if we ever talk. But I'm here to discuss with you women's health, as it says, women's health, stress, and hormones, and what it is to take a functional medicine approach to women's health. As a naturopathic doctor, that is the cornerstone of what I do, the kind of medicine I practice. And so we'll get into that more once we get through the presentation. This is something I've really been wanting to do for a long time, and I'm so excited to have put all this information together in a presentation for you guys. And this is really just skimming the surface. There's a lot more to come, a lot more to learn, but this is just a really great introduction for those who are interested in a holistic natural approach to women's health. So what is functional medicine? The Institute for Functional Medicine defines it as a healthcare model that determines how and why illness occurs and restores health by addressing the root causes of disease for each individual. It is an individualized, so it is unique to you. Patient-centered, it's all about you as a patient. Science-based, so we're all about evidence and testing. Approach that empowers patients and practitioners to work together. So really it is a relationship that we establish to address the underlying causes of disease and promote optimal wellness, right? So underlying causes, that's the root cause medicine. We want to understand what's going on underneath your symptoms and why they're happening. And then promote optimal wellness, really get you feeling your best. So the functional medicine model requires a detailed understanding of each patient's genetic, biochemical, and lifestyle factors and leverages that data to direct personalized treatment plans that lead to improved patient outcomes. And that's really the goal, improve patient outcomes. That's really what we want. We want you to get better. By addressing root cause rather than symptoms, practitioners become oriented to identifying the complexity of disease. As a result, functional medicine treatment targets the specific manifestations of disease in each individual. All this is to say is we're finding out the root cause, we are treating you as a unique individual, and we are addressing everything step by step, inside out, top down. You're not just your symptoms, there's a lot more to you. And then we are addressing that all with a natural holistic approach. So here's just a really nice graphic that breaks down what conventional medicine is versus functional medicine. So it's kind of what we just talked about already, but we can go over it. So conventional medicine is a symptom-based treatment versus functional medicine goes into the underlying root cause. The conventional medicine is doctor-centered versus functional medicine is patient-centered. So we look at you. You are the most important piece of this puzzle. Conventional medicine, all patients receive the same treatment versus in functional medicine, there's a customized holistic approach. We also mentioned again, conventional medicine is a system-based diagnosis versus functional medicine looks at everything on an individual basis. Individual biochemical factors are considered. A few other things, conventional medicine is disease-oriented, while functional medicine is health-oriented. We want you to become healthy. The goal is for you to see us until you don't need to see us because you're feeling better and we've addressed everything that needs to be addressed. Conventional medicine, is specialized for a particular disease versus functional medicine treats the whole body. That is not to say they are not specialties in functional medicine. As a functional medicine practitioner, my specialty is women's health and more specifically even PCOS. But when I talk about women's health, I address the whole body. I don't just look at just women's health. So that's the biggest difference. And with conventional medicine, it is about early detection, which is not a bad thing by any means. But in functional medicine, we are actually prevention focused. We want to get you before you even get, start not feeling well, right? There's merit to all of this for sure, to both of these approaches, but the functional medicine approach is just a little bit more comprehensive in the way we look at patients. So again, this is that root cause thing that I was talking about, root cause medicine, right? You have your conditions, which is kind of the branches and leaves of the tree and the puzzle pieces, right? And then you have your root causes. So, conditions that or symptoms, that we can look at are allergies, autoimmunity, cardiovascular disease, chronic fatigue, digestive issues, hormones, mental health, metabolic disorders, neurological disorders, sleep disorders, and thyroid and adrenal health. And the root causes of all of these various conditions and associated symptoms can be multiple. It can be chemical sensitivity, chemical toxicity, heavy metals, chronic stress, the circadian disruption, digestive problems, hormone imbalances, immune dysfunction, and infections. So that's just a few. There's a lot more that goes that goes under the category of root causes, and obviously there's a lot more conditions and symptoms that patients present with. So why is women's health so important? So the topic of women's health is extremely important for many reasons. As women, we wear many hats, and in order to be effective in everything we do, we must be healthy enough to do it. So our wellness is affected by multiple lifestyle and medical factors, our response to stress, our female hormones, our mental health, weight gain or weight loss, metabolism, proper nutrition, and exercise, just to name a few. And we'll get into each of these as we go through this presentation. So I really like this graphic right here. So it says the health of a woman, right? And it breaks it down into 6 categories: autoimmunity, oncology, aging and bone health, gynecological and sexual health, reproductive health, cardiovascular health, and cognitive and brain health. But look at all these bubbles that stem from each of these categories. So a comprehensive approach will look at all of this all together, make sure we look at all the root causes, address all the symptoms, and also this really just shows how complex women's health is. There's so much involved. So let's talk about the issues. So obviously women's health is our main topic. We have prevention, we have weight issues, we have fitness, we have mental health, breast health, heart disease, fertility, menopause, and stress. Those are some of the bigger topics in women's health. We also talk about stress and how it impacts women's health, right? So, and there's actually 6 types of stress. There's physical stress, chemical stress, mental stress, emotional stress, nutritional stress, and traumatic stress. And we could talk about stress for a very long time. This is just a quick intro to that. And then we talk about hormones. And there's so many more hormones than the ones listed right here, but these are the foundational hormones. We have your estrogen, progesterone, testosterone, then we have your cortisol/adrenal hormones, and then we have your thyroid hormones. So let's talk about hormones. I love this image. We're not going to get into any of the details here, but basically what this shows us is how complex women's hormones are. This is a huge, what I like to refer as web of hormones. And even when one hormone is off somewhere, anywhere here, everything can topple like a domino effect. It takes just one thing to be off for a lot of things to start going wrong. So I really love this image because it really just, and this is not even all of it, this is just some of the more basic hormones, believe it or not. But there's a lot more that can be explored, but this is a really great way to see how important it is to get all the hormones under control. So let's talk about estrogen and progesterone. They're 2 of your sex hormones. During reproductive years, ovaries make high amounts of estrogen and progesterone. The estrogen peaks right before your ovulation, while progesterone peaks sometime after ovulation. Small amounts of both are made in the adrenal glands as well. Some estrogen is also made in your fat cells. So here's a really nice graph of estrogen and progesterone as you go through your female cycle, right? Day 1 is the first day of your period. Day 28 is the end of your cycle, and this is, for a standard typical 28-day cycle, which is definitely not representative of all women, but just so we have an understanding of the phases, we have your menstrual phase, which is usually days 1 through 5. Then we have your follicular phase, usually leading up to ovulation, which is about halfway through your cycle. And then we have your luteal phase, which is from after ovulation till the end of your cycle. So you can see, like we said, estrogen peaks right before ovulation, also peaks a little bit after ovulation in the late luteal phase. And also that's when the progesterone peaks in kind of the mid to late luteal phase. So what is estrogen? Estrogen, when we say estrogen, we're talking about total estrogen, but there's actually 3 types of estrogens. Estradiol, which is your main estrogen, and then we have estrone and estriol. So estrogen regulates menstruation, fertility, and menopause. It stimulates growth of breast tissue, maintains vaginal blood flow and lubrication, causes lining of the uterus to thicken, and has many other functions, including preserving bones. During menopause, the levels will fluctuate and become unpredictable. Eventually, the production of estrogen falls to a very low level once you're in deep into menopause. Estrogen is so important, as you see, for so many reasons, and it can be depleted, or it can go out of control when you have hormone imbalance, and obviously it will become depleted through menopause. Then we have your progesterone. What does that do? Regulates your menstrual cycle. It prepares the lining of the uterus for a fertilized egg, helps maintain and sustain pregnancy, stimulates bone building. So progesterone is huge, number one, when it comes to regularity of your cycle, number two, when it comes to the fertility pregnancy process, right? And then production stops during menstrual cycles when there is no ovulation and after the final menstrual period. So a lot of women that will have low progesterone are most likely not ovulating. Then we have estrogen. So now let's talk about some of the conditions, right, that can happen when you have an imbalance of progesterone and estrogen. So this one is called estrogen dominance, and basically where estrogen levels are abnormally high relative to progesterone levels. So what are some causes? Chronic stress, poor gut and liver health, environmental toxins, lack of ovulation, insulin imbalance, genetics, weight gain, and post-birth control pill imbalance. Some of the signs and symptoms of estrogen imbalance is PCOS, or it's known as polycystic ovarian syndrome, uterine fibroids, fibrocystic breasts, PMS symptoms, menstrual irregularities, hot flashes, mood issues, insomnia, and fatigue. So, the symptoms are quite varied and can also be reflective of other conditions, but when we test your hormones, we see whether it is estrogen dominance or not. Then we have testosterone. Although it is known as the male hormone, it's actually extremely important to women's health. It plays a key role in women's estrogen production. It contributes to a healthy libido. It may help maintain bone and muscle mass, and it helps with growth, maintenance, and repair of reproductive tissues, including the ovaries, uterus, and fallopian tubes. The levels will peak in a woman's 20s and decline slowly thereafter. By menopause, level is at half of its peak. The ovaries continue to make testosterone even after estrogen production stops. So, with menopause, you might still find levels of testosterone that are normal, so to speak, but it will eventually decline. Testosterone production from adrenal glands also declines with age, but continues after menopause. So, we talked about why testosterone is important, right? And why you don't have too low levels, libido, physical strength, and all those other important roles that it has. But what happens when you have high testosterone? So number one, some of the causes of high testosterone is PCOS, congenital adrenal hyperplasia, basically a genetic disorder of your adrenals, general adrenal dysfunction caused by stress, steroid use and abuse, testosterone replacement will cause you to have high levels of testosterone, but that's what it's meant to do, obviously, and DHEA supplementation. DHEA is a hormone that's actually a precursor to testosterone, so it converts into testosterone. So sometimes when you supplement with DHEA, and there's reasons for doing that, it will cause your testosterone to spike. Some of the signs and symptoms of high testosterone, ones you will actually find with women with PCOS, because they almost always have high levels of testosterone. So it's excess acne, abnormal face and body hair growth, commonly known as hirsutism, male pattern baldness, menstrual irregularities, weight gain, and fertility issues. So what are general symptoms of hormonal decline? And, we talk about each hormone separately. Estrogen decline, you will have hot flashes, night sweats, common with peri-menopause, menopause, post-menopause, palpitations, fatigue, headaches, insomnia, bone loss, and vaginal dryness. And then you'll have progesterone decline. Your periods can become heavier and longer, cycles can become shorter or delayed, or just completely absent. You really need progesterone to have a cycle. And it's obviously common with PCOS, as we mentioned before. And now testosterone decline, low libido and sexual desire. It affects sexual satisfaction. It causes depressed mood, muscle weakness, and lethargy. Also all very similar symptoms to what you feel in that perimenopausal, menopausal phase of life. So speaking of perimenopause, so what is it? It's time for when symptoms start lasting to 1 year after the last menstrual period. So it's basically the stage before menopause, before you're officially diagnosed as having reached menopause. Symptoms are increased PMS, irregular periods or changes in length and flow, hot flashes, and night sweats. Progesterone levels decline due to a lack of ovulation, and this increase in frequency through the 40s. Too much estrogen is relative to progesterone, right? We talked about that. Estrogen dominance can happen in perimenopause, and estrogen and testosterone may begin to decline too. So all kinds of things can happen with your hormones. It kind of goes up and down. In perimenopause, there's no stability when it comes to hormones and can change from day to day. And then what is menopause? So it's a complete cessation of your menstrual cycle. So you're officially menopausal when no menstrual cycle, there's no menstrual cycle for 12 consecutive months. So basically 1 year after your last period. The average age is 52 to 52 years, but it can range anywhere from 40 to 58. And I have patients who are menopausal in that age range as early as 40, believe it or not. And the lucky ones as late as 58. Due to increased activity of the ovaries and the cessation of ovulation, basically, or due to decreased activity of the ovaries, cessation of ovulation is basically what happens when menopause starts. You have decreased estrogen and progesterone levels. You also may have low thyroid and low adrenals, right? And that can make your menopause symptoms worse. So those were, that was all the information related to your sex hormones, estrogen, progesterone, testosterone. Now let's talk about a few other important hormones in your body, specifically a few important glands that produce those hormones. So we have something called your thyroid gland, and that is the gland that's sitting right here, and it has so many roles. And we'll get into it in a second. But basically, a low functioning thyroid gland, we call that hypothyroidism. And some of the labs that we look at when it comes to diagnosing hypothyroidism is a high TSH, a low free T4, a low free T3, and a high reverse T3. So there's dietary causes to hypothyroidism, more specifically nutrient deficiencies, iodine, zinc, selenium, and iron. Autoimmunity can also cause hypothyroidism. There's something called Hashimoto's thyroiditis, which is a presence of thyroid antibodies in your system. And so what are some symptoms of hypothyroidism? Low body temperature, slow metabolism, weight gain, fatigue, constipation, depression, hair loss, thinning hair, dry skin, low libido, menstrual disorders, and severe menopause. Think about how many things the thyroid is involved in that it can cause all of these symptoms. And then we have your adrenal glands. And by the way, let me just pause for a sec. When it comes to thyroid, this conversation can last forever. I could talk about the thyroid for hours, and I'll probably have a separate webinar about it at some point, but that was just a quick look at what it means when you have a low functioning thyroid, which is the case with when it comes to thyroid issues. That's usually the case, not hyperthyroidism, and that's something we'll touch on in a future webinar. But the thyroid is extremely important, so I wanted to make sure that we covered the basics of it here. And then we have your adrenal glands, okay? So there are two glands located on top of each kidney. And essentially, these are our stress glands. They produce a variety of hormones. Cortisol is the main stress hormone. It's the main hormone that they produce, although there's other hormones as well. Also, sex hormones are made there. DHEA, testosterone, progesterone, estrogen to some extent. And as we age, ovaries make less estrogen and progesterone, so the adrenals pick up the slack, and that puts a little pressure on the adrenals, but also it's nice knowing that when that we have other organs supporting our sex hormone production. So let's talk about stress and hormone, as I put it, imbalance, right? So we mentioned there's a few types of stress, but what happens when you're stressed? So when you have acute stress, that causes a peak in your cortisol. That's that main adrenal hormone, right? So high cortisol means you're in fight or flight mode, right? That's kind of like when they say, you know, when you're standing in front of a bear, right? That's that fight or flight mode. So initially you'll have the high cortisol, and initially you'll have elevated DHEA. Eventually though, the DHEA, testosterone, and estrogen decrease, Because all the raw materials are being converted to make cortisol. And why are we making cortisol in these acute situations, in these fight or flight situations? Cortisol acts as a compensatory mechanism. It basically compensates for the stress, right? It allows you to deal with the stress properly. But unfortunately, in order for your body to manage the stress, the adrenal glands are compensating by overproducing cortisol. So high cortisol is good in acute situation, right? It increases blood sugar for fuel. It shuns blood to the periphery to run, right? Like running away from a bear, as we just talked about. And it decreases inflammation to manage response to injury. So short term, in acute situations, high cortisol is good, but you don't want it to be constantly high, constantly peaking, right? And so what happens when you have chronic high cortisol? It can raise your blood sugar, resulting in insulin dysregulation and diabetes. It can cause abdominal obesity, which is a risk for metabolic syndrome. It can cause fluid retention and hypertension, high blood pressure. When you have chronic high cortisol, it can cause breakdown of structural proteins in muscle, bone, connective tissue, hair, and nails. So lots of things start to suffer. It will impair your immune system, and then this can result in chronic infectious diseases. And last but not least, it lowers sex hormones, right? The estrogen, progesterone, and testosterone. So what is adrenal fatigue, or nowadays they like to call it more adrenal dysfunction? Basically, chronic stress leads to eventually low cortisol. So we start with the high cortisol in fight or flight mode, and that's our stage 1 of adrenal fatigue. And then we get into, or adrenal dysfunction, then we get into the later stages where you actually eventually deplete your cortisol, because your adrenal glands are so tired of overproducing cortisol as a way to compensate. They eventually get completely depleted and stop producing cortisol altogether, which is ultimately a worse situation to be in. So you definitely want to catch adrenal dysfunction, in stage 1 where cortisol is still high. You'll also have low DHEA and testosterone. You'll have less estrogen and progesterone, which worsen symptoms of peri-menopause and menopause. What are symptoms of adrenal fatigue? Low energy, both mental, physical, insomnia, anxiety and depression, weight gain with high or low cortisol, hair loss, joint pain, inflammation, allergies, and autoimmune disorders, to name a few. So here are the 3 stages of the adrenal dysfunction I just talked about, right? Here's your good health, right? Everything is in balance and homeostasis. Then you go into that alarm stage, the fight or flight stage of adrenal dysfunction. The resistance stage is stage 2, is where although your body starts fighting back, right? It starts trying to get used to the situation. This is not something you want to get used to, right? Having chronically high cortisol. So at that point, the cortisol starts becoming depleted even more, and then you have your exhaustion stage, which they here call the panic zone, right? And this is where you have breakdown or burnout, right? And we're talking about the bad kind of stress here. And also this first stage, the alarm stage, I like to call it the wired and tired stage, right? Your cortisol levels may be high, but you're so fatigued, you're so tired. So this is just a nice little image right here. So now let's talk about stress and how it affects your thyroid. So basically, stress suppresses the function of what's called the HPA axis. So the H stands for the hypothalamus. So the hypothalamus is release of TRH. The pituitary, that's the P, pituitary is release of TSH, and the thyroid gland production of thyroid hormones, T4 and T3, all get off track. And also with chronic stress, you don't convert T4, one of your main thyroid hormone, to T3, another one of your thyroid hormones. So stress just really messes with your thyroid balance. Chronic stress causes the production of inflammatory cytokines, which blocks the conversion of T4 to T3. And the adrenal exhaustion causes low cortisol eventually. And then the cortisol is needed for T4 to T3 conversion. So you see how it's all connected? Remember back to that picture I showed in the beginning? It's all connected. And so then, obviously healthy adrenals are the key to a healthy thyroid. So, and they really go hand in hand, and rarely do I see someone come in with adrenal issues and not have thyroid issues, and actually vice versa as well. And that's that HPA axis we just talked about. So the hypothalamus, so we have your hypothalamus here, Then you have your pituitary gland, and then you have your adrenal gland, so that's the HPA axis, and then you have also your thyroid gland. And you see how it's all connected, all these arrows, all these feedback mechanisms. So it is so important to get everything balanced properly. So then let's talk about stress and sex hormones. So right, as we mentioned, acute stress results in high cortisol. High cortisol causes worsening of estrogen dominance and causes a decrease in progesterone. So again, it's just this vicious cycle. And then progesterone and thyroid. Progesterone helps convert the T4 to the activated form, which is the T3. Stress, adrenal fatigue, and then menopause and hormonal disorders can cause low progesterone. So that starts negatively affect the thyroid, and you can't balance the thyroid without balancing the other hormones. So again, sex hormones, thyroid, and adrenals. It's this trifecta, right? So let's talk a little bit about naturopathic medicine. So what is naturopathic medicine? So again, as I mentioned, I am a naturopathic doctor. So naturopathic medicine is a science-based practice that promotes wellness by identifying the unique aspects of each patient and then employing non-toxic natural therapies to restore their physiological, psychological, and structural balance. Kind of sounds familiar, right? Because naturopathic medicine is functional medicine. Most naturopathic providers will practice functional medicine. So naturopathic doctors follow 6 key principles with every patient. This is the first thing we learned when we went to naturopathic medical school, actually, and this stays with us throughout our practice. So first, do no harm. The healing power of nature, identify and treat the causes, treat the whole person, doctor as teacher, and prevention is the best cure. Again, sounds a lot like functional medicine, right? So what is the naturopathic approach to women's health? So it's multi-pronged. So we have nutrition and lifestyle, we have mind-body therapy, we have specialty testing, herbal supplements, nutritional supplements, and bioidentical hormone replacement therapy. So let's break that down a little bit. Nutrition and lifestyle. So what are some great suggestions for nutrition and lifestyle in that realm that work to help things in women's health? So we can swap carbohydrates for healthy fats. We can increase anti-inflammatory foods, herbs, and spices such as avocados, wild-caught salmon, turmeric, coconut oil, and we can eat foods high in omega-3 fats like wild fish, flax seeds, walnuts, and chia seeds. We can avoid processed and highly refined foods. We can reduce consumption of caffeine and alcohol. Eat clean whenever possible, natural and organic foods. I know it's not easy and can get expensive, but especially when you're dealing with a specific health concern, it's good to try and implement that. And then exercise 30 minutes a day. No crazy workouts are necessary. Start slow, do what feels right for you. Moderate exercise is best. Avoid high intensity if there is a hormone imbalance. High intensity exercise will cause more of this hormone imbalance, and it will, raise your cortisol ultimately, which we want to avoid. Then we talked about mind-body therapy, and that includes a few different things: stress management, detoxification, counseling, meditation, exercise, prayer, and sleep. So the University of Massachusetts research showed that mindfulness training based on the concept of meditation reduced the distress associated with hot flashes and improved physical and psychosocial functioning. That's pretty amazing. Another study noted that memory problems for peri- and postmenopausal women likely stem not only from declines in estrogen production, but also from poorer sleep quality, more depression, and the onset of hot flashes. Mind-body activities like meditation, hypnosis, mindfulness, and yoga offer a holistic approach that can improve self-reliance without medication and with no risk of side effects or drug interactions. According to the Harvard Health, there are 6 relaxation techniques that can help you evoke relaxation response and reduce stress. So I love this stuff. Okay, so first we have breath focus. So in this simple, powerful technique, you take long, slow, deep breath, also known as abdominal or belly breathing. As you breathe, you gently disengage your mind from distracting thoughts and sensations. So literally, breathe in through your nose, hold it, hold it, hold it, and just release. It's as simple as that. You can do it throughout the day, morning, day, and night. Body scan, I love this. So blends breath focus with progressive muscle relaxation. So after a few minutes of deep breathing, which is what I was just showing you, you focus on one part of the body or group of muscles at a time and mentally releasing any physical tension you feel there as you do that. A body scan can help boost your awareness of the mind-body connection. I love this. I think this is amazing. The mind-body connection is so strong. And as a naturopathic doctor, that is something I really focus on. So I am glad that there's actually, studies and a lot of information coming out on this. You can do guided imagery. For this technique, you can conjure up soothing scenes, places, or experiences in your mind to help you relax and focus. You can find free apps and online recordings of calming scenes. Just make sure to choose imagery you find soothing and that has personal significance to you. Mindfulness meditation, love this. This practice involves sitting comfortably, focusing on your breathing, and bringing your mind's attention to the present moment without drifting into concerns about past or future. So a lot of this stuff involves you kind of relaxing, deep breathing, and just letting go. We have yoga, tai chi, and qigong, three ancient arts that combine rhythmic breathing with a series of postures or flowing movements. Again, we're talking about breathing here. The physical aspect of these practices offers a mental focus that can help distract you from racing thoughts. And then lastly, repetitive prayer. For this technique, you silently repeat a short prayer or phrase from a prayer while practicing breath focus. For those people that are religious, this is a great outlet as well. Then we do specialty testing, and that, we can talk about specialty testing also for hours, but I'm just going to give you kind of the overview here. So we have your standard blood test that can measure sex hormones, thyroid hormones, specialty markers, and also basic blood panels like the CBC, CMP, nutrients, and lipids, and blood sugar, and lots and lots of other great markers. Also assesses you for autoimmunity. Then you can, through saliva and or urine, you can measure your sex hormones and adrenals as well. And they often do both a blood test and the saliva or urine test. And then other tests that we can do is a urine test to check metabolic function, and a variety of gut tests, a digestive health test, stool, breath test, urine test, and blood test to assess digestive health. Then we, one of the things I do as a naturopathic doctor is, of course, recommend supplements. So there's some really great supplements for female health. So some female hormone balance supplements. There's an herb called chaseberry, also known as Vitax. There's also something called black cohosh. These are really great hormone balancing herbs. Then we can help you balance your adrenals through ashwagandha, rhodiola, and licorice. These are all adaptogens. That's something that we'll talk about in the future. But these are all herbs that help you balance your adrenal glands. And then there's things like pregnenolone, DHA, vitamins and minerals, and something I also wanted to mention is phosphatidylserine, another favorite of mine. And these are various nutrients and herbs basically that will help you balance your adrenal glands. And for the adrenals, we can have high cortisol, low cortisol, high DHA, low DHA. So these are all things that we take into consideration when we recommend supplements. And then we can have, there's supplements for thyroid hormone balance. Some ashwagandha is great for thyroid and for the adrenals. Google, turmeric, those are herbs and spices. And then we have certain nutrients like NAC or NAC, as people like to call it, L-tyrosine, zinc, selenium, iodine, and vitamins A, C, and E. And then there's bioidentical hormone replacement. So what are bioidentical hormones? That word is thrown around a lot, but what is it really? So these are identical in molecular structure and function to the hormones women make in their bodies. So that alone just tells us, it's as natural as you can get when it comes to hormones, right? Oh, and literally, I didn't even read the next line, but that's what I hear when I, read that description. So, and they're all made from plants. These hormones include estrogen, progesterone, testosterone, and they come in various forms: creams, capsules, gels, patches, sublinguals, tablets, and vaginal applications. They're also natural options for thyroid hormone replacement too. Bioidentical hormones are FDA and USP regulated, and studies that determine the risk of hormone replacement, such as cancer, stroke, heart attack, only apply to synthetic hormones, not to bioidentical hormones. I do want to say there is one thing that does preclude you from doing bioidentical hormone replacement, and that's if you yourself have ever had breast cancer. Otherwise, most women are good candidates. It's been shown that bioidentical hormones, once you start, you can, if you want to, you can take them for the rest of your life safely and with a lot of benefit. So this is it for today's webinar. this is women's health, holistic health, naturopathic medicine, functional medicine in a nutshell. There's a lot more that can be said about each of these individual topics, and eventually I will hopefully create webinars for those things. The next 2 webinars I have planned, PCOS, which as I mentioned is my main specialty, that is under the umbrella of women's health. PCOS is polycystic ovarian syndrome, and right now the statistic is that 1 in every 10 women has PCOS, so that's pretty significant, and this is the majority of the patients I see. And also I want to do a quick webinar, it's going to be a shorter one, on immunity. Obviously in the current state of the world that we live in, with all the immune system related things that are going on with the pandemic, I want to quickly touch on immunity as well. So that will be a webinar I will have up soon, hopefully. I am so excited to have done this. I have been waiting to do this for a long time, and thank you to everyone who has watched this, who has listened to this. Let me know if you have any questions. You can contact me at gm@drgalinand.com. And there's actually also my website, drgalinand.com. So I am looking forward to hearing from you, and thank you so much for being here with me today.